Hello, I would like to start off this video by explaining that I will be filming the presentation on my phone. I am unable to use Canvas Studio on my iPad to screen capture, but I chose to do my presentation on cystic fibrosis. People with CF are born with this genetic disease. 30,000 children and adults in the US are affected. 1,000 new cases are diagnosed each year. CF occurs in 1 of every 3,200 Caucasian births and 1 of every 15,000 African American births. CF is less common in Native Americans and Asian Americans. More than 80% are diagnosed by age 3, 10% are 18 or older, and 3% are diagnosed as adults. The disease is fatal, meaning there is no cure. Individuals with CF are affected by their symptoms every day. The median age of survival is 35. Advances in treatment are growing steadily, causing affected individuals to live longer. 40% of the CF population is 18 or older. Factors that help the disease include early diagnosis, aggressive therapy, and routine checkups. CF is a genetic or inherited disease. Individuals with the disease must inherit 2 defective CF genes, one from each parent. If both parents are carriers, there is a 25% chance that the child will be born with CF, a 50% chance that they are a carrier, and a 25% chance that they are not a carrier. More than 10 million Americans are unknowingly a carrier of the defective gene because they are symptom-free. CF is caused by a mutation in the transmembrane conductance regulator, or CFTR, which is the gene that is passed on to the individual with CF. The CFTR gene provides instructions for the CFTR protein. People with CF inherit 2 copies of the mutated CFTR gene, meaning that their body makes a CFTR protein that works abnormally. In an unaffected individual, the CFTR protein regulates salt and water balance by transporting chloride and bicarbonate ions out of the cells. It makes sure that the mucus lining in organs remains hydrated and thin. In people with CF, the protein changes how much salt moves in and out of the cells. These changes cause thick and sticky mucus and increase the amount of salt in their sweat. Thick mucus can block and damage the airways of the lungs and block the digestive system in the body. Inheritance pattern. It is autosomal recessive, meaning a child must inherit 2 mutated CFTR genes from each parent to have the disease. What does it affect? The lungs, airways, intestines, and the pancreas. Thickened mucus in the airways lead to recurrent infections and complications with breathing. It affects the pancreas by obstructing it and preventing digestion and the absorption of fats and fat-soluble vitamins, leading to nutrition deficiencies and intestinal complications. It can also cause CF-related diabetes. Symptoms. Thickened mucus in the airways lead to recurrent infections and complications with breathing. Mucus produced in CF blocks the airways, making it more difficult to breathe, makes the individual more susceptible to respiratory infections like bronchitis and pneumonia, wheezing, chronic cough, and shortness of breath. Thick mucus also blocks the passageways that carry enzymes to the intestines. Enzymes are proteins that aid in digestion. Lack of enzymes can cause poor digestion, poor weight gain, excessive appetite, abnormal stool, hyperglycemia or high blood sugar, abdominal discomfort, and liver disease. The liver disease is caused by blocked bile ducts, leading to inflammation of the liver. People with CF also have reproductive complications from delayed puberty and salty sweat. An abnormal amount of chloride across the cell membrane makes the individual more susceptible to dehydration and heat exhaustion. Treatments include chest physical therapy, or CPT, which is vigorous clapping on the chest to break up mucus, typically done daily, 30 to 40 minutes before meals, or an hour after eating to help block airways. A vest system, or high-frequency chest wall oscillation, is also used. This is where the patient wears an inflatable vest that is connected to a machine that delivers rapid air pulses that vibrate the chest. This thins mucus and shakes it loose from the airways, so that it is easier to cough up. This usually replaces CPT in patients 2 years or older, or patients with a chest circumference of 20 to 23 inches. Positive expiratory pressure, or PEP therapy. Patient exhales through a restricted opening, which creates a buildup of back pressure in the lungs. This pressure causes the small airways to expand so that the thick mucus can move easier through to the large airways and be coughed out. Aerosol therapy is also used and is typically a daily regimen. A fine mist of medications is inhaled into the airways using a compressor, which blows air into a nebulizer or a cup that changes liquid medicine into a mist, typically administered using a mask for infants and a mouthpiece for children 6 years or older. This is usually used in conjunction with vest therapy. The medications used are typically albuterol or other mucus thinning drugs. Changes to diet can also be helpful, consuming a high calorie deficit and a lot of protein. Digestive enzymes in pill form taken orally when eating meals so that the fats, starches, and proteins can be absorbed. Vitamins A, D, E, and K for fat to be absorbed are also helpful. Exercise is recommended to maintain chest muscle strength and to clear mucus from the lungs, about 30 to 60 minutes a day. I chose the topic of CF because my older brother lost his battle to this disease in 2008 at the age of 17. I was young at the time and knew he had to go through treatments and did not understand why. I never researched the disease as I got older because it was difficult to think about, but learning the cause and reason for the symptoms of individuals affected will help me to raise awareness for the disease. My family and I organize a walk annually to raise awareness and raise money for the Wisconsin CF chapter in hopes of finding a cure. And these are my references. Thank you.